Hello, my name is Michelle Wynn. Today I will be demonstrating the insertion and discontinuation of a peripheral IV. The supplies that I'll be using, I have a patient and this is their forearm. I have an IV start kit. I have saline flush. I have a catheter. I have the extension tubing. I have two pairs of clean gloves and I have a sharps container. I will begin by reviewing the physician orders. I will gather my supplies. I will proceed to the patient's room. I will knock before entering. I will close the door or curtain behind me to ensure patient privacy. I will place my supplies down on a clean, dry, flat surface. I will perform hand hygiene, put on my gloves, and introduce myself to the patient. Hello, my name is Michelle, and I'll be your nurse today. Can I please have your first, last name, and your date of birth, please? Thank you. So I have verified that information against their wristband. Ms. Jones, today your doctor has ordered hydration fluids, so I will be starting that for you. I'm going to get my equipment together, okay? Okay, so I will begin with flushing the tubing. I will remove the tops. Okay, now I will connect the extension tubing to the saline flush. I will be priming the tubing to remove any air or air bubbles. Okay, and once that's done, I will clamp this and I will set this aside for later. So Mrs. Jones is a 75-year-old female. She is here for rehydration fluids. Um, we are not anticipating any surgery or any blood products. Therefore, we are going to use a 22 gauge, 1-inch needle catheter. Okay, and now I'm gonna get my supplies out of my IV start kit. Okay, Ms. Jones, I am going to apply this tourniquet to your arm. If at any time you experience discomfort, please let me know. Okay, when applying that, you want to put it 4 to 6 inches above the insertion site. Let me tie that a little better. When tying, you want to make sure that it is secure. You don't want to tie it too tight. And you can just double check to make sure that the patient, you can feel their distal pulse, and I can feel that. Okay, now I want to clean the insertion site. You will clean it in a circular motion and you will go from the inside to the outside. Okay, next, you want to anchor the vein. You want to go about 1 to 2 inches below the insertion site. And you want to hold the skin tight and you want to gently stretch in a direction against the insertion site. Okay. You want to make sure that the bevel is up when inserting. You want to insert at a 45-degree angle. You want to make sure that you observe flashback, and I do see flashback. So I am going to lower the catheter. It's kind of parallel to the skin, and then I want to push that in farther. I'm not pushing the needle in, I'm just pushing the catheter in. Okay. Okay. And now I am pulling out the needle. Typically, I would press the white button, which is the security mechanism, and it would retract the needle and the needle would go in the tubing. But this is my last needle and I want to keep it intact. So I'm not going to retract it, but I am going to place this in a sharps container. I want to release the tourniquet. Okay, and now I want to attach the saline. Okay, and then I want to aspirate until I want to release the clamp. Aspirate until I see blood, and then I want to slowly put some saline solution in. Okay, now I am going to reclamp, and then I am going, let me reclamp. I'm still securing that. Now I want to disconnect the saline solution and discard that. Okay. Next, I want to assess the site to see if there's any bale formation. I'm checking for infiltration, and I'm just checking to make sure that there's no discoloration. Now I want to apply the dressing. My dressing is currently labeled. So what I have labeled on my dressing is the date, the time, my initials, the gauge size, and the needle length. So now I want to secure this with some tape. I've already torn the tape off. And I'm going to do the chevron method underneath. And then I'm going to place another on top. And now I want to secure this. Now this white piece would typically come off, but I want to be able to use this again, so I'm keeping it on here. So as you can see, my dressing is on. It's not covering the tubing. It should never cover the tubing because you may need to change out the tubing. And again, my label is on here and nothing is obstructing the site. You need to be able to see that. Okay. Okay, so that's in. I will clear out and remove any supplies. I will take off my gloves, perform hand hygiene. Okay, Ms. Jones, now the catheter is in, the IV is going now. I am going to leave and document this. Your call light is near you. If you need anything, please let me know. Okay, some time has passed, and now I am back because the doctor has requested to discontinue the IV. So I will do the normal procedure. I will get the supplies that I need, which is sterile gauze and tape. I will place that down. I will perform hand hygiene. I will put on clean gloves. I will again verify my patient's name. I will check their wristband. Um, and then I will let them know why I'm there. And I just want to make a note, the tourniquet, it should have been removed when I removed all of the other supplies. It would not remain on my patient like that. Okay, so Ms. Jones, I am back. I am going to remove this, okay? So I will begin by removing the tape. And when removing, you want to ensure that you do it gently because the skin is sensitive and you don't want to tear or cause any irritation. So I will begin by removing the tape. I will remove the dressing. And I'm securing the catheter. I am going to get a sterile gauze and place it above the insertion site. And then I am going to slowly but steadily remove the catheter. I will inspect the catheter. I will be checking for the integrity to make sure that it's intact and also verifying the size. And then I will dispose of this in the sharps container. While I'm doing that disposal, I'm also still applying pressure to the insertion site or where I'm discontinuing at. You want to apply pressure for 30 seconds or more, depending on when the blood is controlled. Okay. So I see that the blood is controlled. So I am going to get another gauze. I'm going to dispose of that. Put the new gauze on and secure it with tape. Okay, I am going to gather my supplies. Okay, Ms. Jones, I am finished with this. I am going to go document this. Do you need anything before I leave? No? Okay. Let me dispose of my gloves, perform hand hygiene. Okay, Ms. Jones, I will be back. End of skill.